Well, good morning and welcome to My Help My Mississippi on WMPR 90.1. Is that right? Yes. And we're so happy to be in the studio this morning, providing you with some information that you can grab on the run. We're so excited that today is a day that you are going to win. Why? Because you were born to win, and we're the fighters. I'm Chef Charles, and thank you for being a part of My Help My Mississippi every Thursday morning from 7 o'clock to 8 p.m. You're in the right place. And again, hold on to your steering wheel if you're driving. You're going to be tempted to write something down. But remember, you're going to be able to go back and look at this on YouTube. If you at home, please get your pen and your paper because y'all going to need to take some notes today. I am so excited about what we got going on today, guys. Okay, we have in the studio with us, and I'm going to introduce her in just a second. Or I'll let her introduce herself. But Ryan Doty, her story is amazing. What she's doing to change the lives of people. That's what WMPR 90.1 is all about, affecting the community, changing the community. Listen, guys, you don't allow the community to change you. You change the community. You change your environment, okay? When we talk about the food that goes into your body, you make sure you always focus on your brain, your liver, your lungs, your heart, your kidney. These are important people in your life that's going to stay in your life. So we want to make sure that we always giving them the nutrients that they need. That's why I'm so proud to be a part of My Help My Mississippi. And listen, wherever you are, we want to be there. And we always have to have people to help us to get there. And we want to give a shout out to Tabernacle Ministry. Thank you, Tabernacle Ministry, for all your support that you give My Help My Mississippi financially, because you know, you feel that it's important for us to be on the air, to continue to spread the good news that food matters, and that high blood pressure is not mandatory. Type 2 diabetes is not mandatory. High cholesterol is not mandatory. Listen, food matters, but action is required. We got to take some action. Otherwise, we can continue to affect ourselves negatively. Food can help us positively or negatively. Today, we're going to choose to be affected positively. So, no longer do I want you to wait, because I'm going to tease you a little bit. My guest today, and we're not going to talk about it just like right away, but my guest today, if you can see, if you're on YouTube and watching us live, you can see she looks fabulous. But she has lost 190 pounds. Okay, hold on to your stern wheel. I said it right. 190 pounds, right? And her husband has lost 152 pounds. So she's in this, the family, it's a family affair. They're making it happen. And look, guys, you can make it happen too. We're all about better health, mind, body, and medicine. And the work that she's doing in the community to helping everyone understand how food can affect you mentally, and how you can help yourself mentally and physically by talking to people. You're not in this alone. You're not by yourself. We're all in this together, and that's why we want to bring her in. Good morning, Ryan, and welcome to My Help My Mississippi. You doing good this morning?
I am. How are you doing?
I'm doing so wonderful. I've been waiting on this day. I had it. I had it on my calendar, and I've been trying to rush it up, but it wouldn't. It wouldn't move. You know, it's at the 26th, and the 26th was gonna come when the 26th comes.
Yeah.
But I was trying to get it to come a little faster. We met. I think it was in Hattiesburg,
Yes, sir.
and you shared your story with me a little bit, and I didn't believe it. I said, "Show me a picture," so I had to see an old picture. But introduce yourself. Tell us about where you work and what you're doing for the community, and then we'll jump into some other things. Okay.
Okay. Well, my name is Ryan Doty. I am a psychiatric mental health nurse practitioner. I'm actually associated with two wonderful practices here in the Central Mississippi area. I'm with Magnolia Psychiatry.
Okay.
We are a brand new clinic that just opened April 1st of this year.
Okay.
And I work with two other wonderful nurse practitioners, Victoria Carroll and Brianna Lovelace. And I specifically have a special interest in disordered eating patterns and substance and behavioral addictions.
Okay.
But we also treat the gamut of mental health conditions. I'm also associated in the North Mississippi area with a clinic called Allegro Behavioral Health.
Okay.
And that's actually, they've had one clinic open, they just opened a second, and they've asked me to help them part-time get that clinic up and going. So just started that actually last week.
Okay. So you're busy changing lives.
Yes, trying to.
That's what it's all about. Your life has changed so much, and now you're able to share how other people can change yours. So, disordered eating habits,
Yes.
why was that important to you?
Because, I struggled with my weight my whole life. When I was a kid, I was considered chunky.
Chunky, yes, that's a nice name, isn't
Um,
it? Okay.
But as I got into college, my weight increased, just poor eating habits, partly genetics, but definitely poor eating habits.
Yeah.
So over time, I started realizing that I was very depressed, very anxious, always worried about how I looked and what people were going to think of me as my weight increased. Um, I think I subconsciously realized, well, I don't think I realized, I think subconsciously my brain realized that food brought me comfort.
Right.
And I started this pattern of binge eating to try to chase that feeling of happiness that I once had
Mm-hmm.
and wasn't finding that
Right.
as time went on. So disordered eating patterns has been a very personal issue to me because I've struggled with that for years. And I particularly like binge eating,
Mhm.
but I also, help to treat anorexia, bulimia, just the restricting and purging kind of disordered eating patterns and the excessive exercising,
Mhm.
things like that.
Yeah. Explain to our audience, for those who don't know, what binge eating is.
So binge eating is episodic. It's a pattern of eating way too much food, a lot of times to the point of being sick yourself or just being so miserable that you can hardly breathe.
Right.
But it comes in episodic waves. My waves pretty much were daily. Some people will do, for 3 days they binge eat and then for weeks they don't. But mine were pretty much daily. I think I was seeking something that I was missing as far
Okay.
as my mental health went.
And you found comfort eating
In food.
in food.
Mhm.
Yeah.
And always terrible food. It was never fruits and veggies.
Yeah, most of us don't crave. We don't think about, I got this craving for some broccoli. I think I'm gonna go down and get some broccoli. I can't wait. I gotta have them.
Yeah, it was never fruits and veggies.
Yeah, that's really interesting. Do you meet in your practice people who are dealing with some of the same issues that you were dealing with?
Absolutely. There's several therapists in the area that I refer to when I find somebody who does have a pattern of disordered eating. I when I'm doing an assessment with a patient, I always try to assess that. It may not happen on the first visit,
Mhm.
but throughout time, I do try to assess that with every patient because it is one of those things that's not talked about a lot.
Mhm.
And it's one of those things that people don't feel it's a problem until it's brought to their attention.
Right. When you're in it, you're just enjoying it, and you feel like this is the thing to do.
Sometimes they find that it's the only control they have in their life.
Mhm.
And sometimes they find that, like me, food brings them comfort. Um, so I try to assess kind of what that underlying issue is.
Okay. You know, it doesn't help either when we're like we are here in the South and we make food a priority to everything. You know, you want to get together, you want to do what?
Go
You're
out
about
to
to
eat.
eat, right? Want to have a conversation. You want let's grab something to eat, and here we don't have a lot of uh, let's just say vegetarian or vegan places. There may be some option, but there's not like a vegan buffet place, you know, with
Right.
fruits and vegetables and things like that. So
And even when you do find a buffet that has fruits and vegetables, a lot of times the vegetables are cooked in butter or margarine or
yes,
very high saturated fat items.
speaking my language, Cora, that is so absolutely true. Most, and we don't have to, and I share with people all the time, even on my show this past Tuesday, how we can saute onions with either low sodium vegetable broth or water. We don't have to throw butter or oil in there to saute them, but it's what we're used to. And so when we start binge eating, we're going to be doing the wrong type of eating. And what has eating like that cost? Because there's a cost. It costs people obviously to gain weight, but normally your health start to
Yes.
deteriorate. What do you see when you?
So a lot of times I see the health deteriorate, and a lot of times what I see first and foremost, they come to me usually with symptoms of depression, anxiety, irritability, sometimes ADHD symptoms. But a lot of times when we're bringing them in, we're getting their vital signs. We see hypertension. We do draw blood on some patients here and there because some of the medications that I prescribe can cause some, medical stuff. So I do keep an eye on their blood work, and a lot of times I see their A1C creeping up or their glucose is high every time I draw their blood. So I do see a lot of physical problems with, eating the wrong types of food, but I also through my research and through my weight loss journey, I've done a lot of research just to kind of see how can I support my patients in improving their mental health through food.
Say that again, improving your mental health through food. I want you to say that again because I always say the power of food can affect your mood. So
Yeah.
say that again.
I always try to do research in figuring out how I can help my patients improve their mental health through the use of food.
And have you found that to be helpful?
I have found it to be helpful. Even in my personal life, I found it to be very helpful.
Yeah. So when I say the power of food can affect your mood, I'm telling the truth.
Yes,
Y'all heard that from right.
absolutely. It can.
You know, food is so important to our bodies. And I tell people all the time, it's about the nutrients that the body needs. If you neglect the body of the nutrient, it doesn't mean that the body doesn't need them.
Yeah.
It means you are neglecting it. So there's going to be a deficiency, right? And some things are going to start happening negatively, right?
Yes.
And so, regardless of what you're eating, always try and get the vegetables and the fruits in because there are certain nutrients that's in those vegetables and fruit that the body
Yes,
needs,
sir.
right? So, we're going to talk about your journey a little bit later. I'm so excited about this. I kind of want to skip everything else and go straight to it, but I'm trying to be very patient here because this story is amazing. But How long have you been in the field that you're in?
Well, I've been in mental health since 2013 as a nurse. In 2018, I finished nurse practitioner school, and I've been a nurse practitioner since then.
Okay. And is that something that you've always wanted to do?
I think I realized I really wanted to be in the mental health field while I was in nursing school, around 2009, maybe early 2010. My stepdad committed suicide,
Mhm.
and my dad, my biological dad, also struggled with some addiction issues and untreated mental health issues. So I really wanted to get into that field just to kind of see if I could help somebody where I felt like I couldn't help them.
That's amazing. I have a doctor friend that went into that field simply because her family was struggling with. So thank you for just standing up and grabbing a hold to the rope and trying to make a difference. Because when it affects you personally, you have a different kind of connection than just going in it for a career or for the money. You're there for a reason. So thank you for stepping up to do that. I'm sure your family really appreciate it. Well, in doing that, I know you've seen a lot, but I'm more interested in who struggle with this. Is this a everybody? Is it cultural? Is it age wise? Who struggles with this?
I think if everyone were being honest, I think everyone struggles with some type of mental health condition at some point in their life.
Hmm.
It may not meet full criteria for major depressive disorder, but it may just be when you go through a hard time or you lose someone you love, you may just have a period of, where you just can't cope very well.
Right.
So I think if people were being honest, probably 100% of the population
Yeah.
has struggled with symptoms of depression or symptoms of anxiety at some point in
Yeah.
their life.
I 100% agree with you. Now, culturally, I know in the African American community, I grew up, uh, we just didn't talk about our problem. I mean,
Yes.
there's God and mama.
Yeah. Yeah.
We dealt with things. So, how important is it? And I really appreciate, there's not much to appreciate about COVID because it was just like awful, right?
Yes.
But since COVID, so many people now are opening up about their mental health.
Yes.
Have you seen that?
I have seen that. I think, and I saw an increase in my patient population increasing during COVID, and I think that had a lot to do with the isolation
Yeah.
everyone was feeling.
Hmm.
We weren't allowed for a while to go out and spend time with our friends. There were people who were, a lot of my friends are in the medical field, and so they were working in the hospital, and there were people who weren't even going home to see their kids because they were working with such sick people,
Wow.
and we didn't know quite as much about it back then. So
Right.
they weren't even able to go home and see their husbands and kids at times.
Mhm. Now, have you noticed, as I said, culturally in my community, we just didn't talk about that.
Yeah.
Have you seen a difference in the African American community?
I have started seeing a difference. When I first started working as a nurse practitioner, I did not have a lot of African American clients. I did when I was working inpatient because,
You're hospitalized.
yes, they were
Mhm.
hospitalized. So I did see, and I was working in the Jackson, Mississippi area. So
Mhm.
you do see a lot more of the African American population inside the hospital. But when I was doing outpatient, I didn't see that as much. And over time, I've started noticing that more of my patients are Black,
Mhm.
and they're getting more comfortable talking about it. And I even had a conversation with a patient yesterday about why she decided to finally come get some help. And she basically told me that growing up, she was raised in a very religious household that taught her God is the only healer, He is the only counselor you need. And she's been going to a church recently that's a little bit more open minded.
Mhm.
And she was talking to someone in the church, and they told her, you're struggling, and I'd like you to go talk to somebody. And so she did.
Yeah.
But I'm also seeing just advertisements and things. There's more conferences that are geared more towards the minority and Black men. There's actually mental health conferences geared towards Black men
Yeah.
because even more than just the Black community, Black men don't talk about it.
Oh no, too strong.
Yeah.
And we struggle and internalize, and it shortens. It's not scientific, but it's why our life expectancy is so much shorter, because when you internalize everything and stuff start eating on you, then you start having different types of illnesses, and it affects you mentally, physically as well. And you can't thrive, I don't believe, when you're keeping all of this in, and now you're having to deal with medications and different things like that. So I just think when you start talking about mental health, you are talking about physical health as well,
Yes.
because it can affect
It
you
can.
physically when you have the right mental, state of mind. So
Absolutely.
yeah, well, good. Well, callers, if you want to reach out to us while we're here, I mean, I would if I were you. You can call us at 601-948-5950, and we'll try to answer your question. But in the meantime, so Ryan, age-wise, I'm curious, are we seeing young folks, middle-aged folks, older folks?
I'm seeing, honestly, I see anywhere from 13 and up, but I'm seeing more young adults and middle aged. That's when I think they really start to realize, hey, I've got to do something different. But of course, I do have a good bit of the older population that's coming in
Mhm.
first time ever seeking treatment.
Yeah, yeah, I can understand that. After the loss, or it's just so many different things can occur. It's so difficult to deal with these things. And I like the idea of people not trying to do it by themselves
Yeah.
anymore.
Yeah.
Because that's we're not in this alone. And I'm also excited about our young people coming in, because suicide for our young people was on the rise, and
Yes.
it's all because they just didn't know how to cope with life.
Yeah.
Whether it's relationship, even just a lot of mental things, and it can affect us and our children and school itself.
Yes. Yes.
Yeah. Well, good. So tell us, where are you all located?
We're in Ridgeland, Mississippi at Magnolia Psychiatry. We're in Ridgeland, Mississippi, right off of Lake Harbor at 740 Avignon Drive.
Okay. Good. And you do have to have an appointment. You call.
Yes.
Yeah. So,
You can actually go to our website, magnoliapsychiatryms.com, and you can schedule a new patient appointment there, or you can call our phone number at 601 937 4552.
good. So I know that your father struggled with issues, and your stepfather committed suicide, and it kind of helped you to go down this path. Are you happy that you did?
Absolutely. I love what I do. I love being able to help people. Of course, there's frustrating times because, treatment's not going as quickly as you'd like. Um, Sometimes patients aren't as open as you would like them to
Right.
be, but ultimately it's a very rewarding career for me.
Loving what you do matters.
Yes.
Loving what you do matters. I love helping to take people to another level, because in my family, because we didn't talk to anybody, uh, and we didn't have the right food. So therefore, mama died 58, sister died 54, another one died at 52, dad died at 41. I mean, we just needed some help all the way around. We were struggling, dealing with a lot of different things. Now I understand how obese were rampant in my family
Yeah.
because this was the pleasure. I mean, this is the only comfort you got a lot of time. You dealt with issues that like no other dealt with, and this is how you cope.
Yes.
And it's not the best coping mechanism
It is
at all.
not.
So if someone is out there dealing with these kinds of issues, how can food make a difference?
So there's been a lot of studies to suggest that certain foods can play a role in different symptoms of mental illness.
Mhm.
Depression, anxiety, mood irritability, decreased concentration, and inattentiveness.
Yeah.
Um, that's partly why I like to try to assess my patients' eating patterns and kind of the foods that they're taking in, because sometimes through therapy and medication, I'm seeing benefit with
Mhm.
some of these symptoms, but not full benefit. And so I start to try to assess their eating patterns, their food intake, and see if maybe we can make some changes in support of getting those symptoms a little bit better controlled.
You know, what I like about the mental institutions now, they're realizing more and more that food matters. Actually, the conference that I met you at, I was doing a presentation there about how food affect us mentally. And I've gotten so many calls back. People wanted that presentation that I did because it was just unbeknown to a lot of different, you know, people. And they've asked for it. I've readily sent it out. I mean, when you want it, you got it, baby. And so uh, just to see the medical field uh, and the food industry come together and say, you know, we both matter,
Yeah.
and we both play a role here, and you can't just totally go with medication. You need to talk some things out. You need to put the right food in your body. I think Steve Jobs said it best when he said, "If you don't make food your medicine, then medicine will become your food." But do you see the industry changing a little bit?
I do see the industry changing a little bit. When I was working inpatient in particular, we had to use a lot of antipsychotic medications, and those medications can help to those medications can really contribute to metabolic issues, high blood pressure, high
Yeah.
cholesterol, diabetes, weight gain. And so when I was working inpatient, I saw this big shift in our food service where they started trying to incorporate healthier food for our patients, healthier snacks throughout the day to try to help combat what some of our medications were causing.
Yeah, that's good. At least realizing that, and that's what we want more of. We want more hospitals realizing, more doctors realizing that, and thank goodness that the mental institution are realizing that some of the medication is going to have some side effects, but we need to be cautious about what we're feeding you because you don't want to add to the problem as we're trying to treat a problem, right?
Absolutely.
That is great. Well, so we're going to take a break, but we're going to come back and get into the topic that I really want to get into, and that's all that weight loss that you lost and how you did that and so forth. And the husband is on a journey too. And I'm excited about it. So, guys, stay tuned. We'll be right back on the other side with some more of Ryan. Thanks. today, every day, responsible self. Huh? Every day, responsible self. Future in great health. Today, every day, responsible self. Well, all right. Thank you, guys. We're back with my special guest again, Ryan Doty. And man, we're having a great conversation. So thank you so much for being here, Ryan. I really appreciate it. We're going to start talking about what we really want to talk about. All this stuff is important, but really, most people out there, how you lose 190 pounds? I don't believe it. Okay, they want to hear it. But right before we get into Ryan's story, I want to talk about this segment of the program called Who Am I? And we're going to use a vegetable or a fruit or a grain to talk about who am I. So I want you to guess, who am I? I am a good source of vitamin C, potassium, and fiber, especially pectin and type of soluble fiber that support digestive system. So in other words, I support your digestive system. I support heart health. The fiber in me help lower blood pressure, reduce LDL, which is the bad cholesterol, and improve overall heart function. Who am I? I aid in weight management. I am high in fiber and water, making you feel full and reduce overeating. So you're going to feel fuller because of my water content, and you're going to eat less. I am I regulate your blood sugar. The fiber slows down the absorption of sugar, which helps prevent blood sugar spikes. Y'all really need me. I promote gut health. I contain prebiotics that feeds your gut bacteria, which support digestive health, and your immune system. Oh my goodness. And guys, you don't even have to cook me. All right. I reduce inflammation. Have you guessed who I am, right? I am rich in antioxidants like flavonoid, which helps fight inflammation and protects cells from damage. You don't know what I'm talking about, Marcus? Keep listening. I get this. You're gonna love this, right? I support brain health. Yes. Antioxidant in me may help protect the brain, oxidative stress, and reduce the risk of Alzheimer's disease. Wow. I boost your immune system. The vitamin C, antioxidant, and fiber in me all work together to strengthen your immune system. Come on now. Y'all can guess who I am. I protect against cancer. Man, some studies suggest that the antioxidant and flavonoid in me may help reduce the risk of certain cancer, including colon, lung, and breast cancer. Get this last one real quick. I improve lung function. Wow. Regular consumption of me has been associated with better lung capacity and lower risk of asthma and respiratory disease. I am going home and going to eat this as soon as I get home. I consume this every day, by the way. Who am I? You know, they told us in school, and all of you know this, a blank a day keep the doctor away. I am Apple. I am Apple. You don't have to cook me. Listen, I don't care if you're eating applesauce, unsweetened applesauce, but make sure you're getting an apple into your system every day, okay? I'm usually doing one or two. Have it in my oatmeal. I'll eat one, and I'll do it in a fruit salad. I'm just getting into my system every day, Ryan, because here's what I figured out. When I realized how valuable food is to my body, then it becomes priority to my body because I can't neglect my body of things like this and expect to function at my capacity. Now, when I'm neglecting my body of things like this, normally I'm going to end up on some disease or whatever. But this is a way that we can get it into our system and help our system. And you don't even have to create. You can't say, "Well, I can't cook." Okay, just get it out. You don't have to cook. So, Ryan, tell us what we all want to know. 190 pounds. First question. What was your maximum weight?
353 pounds.
353 pounds. And you lost 190 of those, baby. You donated those.
Hopefully never to get them
Never
back.
to get them back. They're gone, right? Tell us how this happened.
Well, as I said earlier, I struggled my whole life with my weight. Throughout college and my early adulthood years, I began a pattern of binge eating, and it led me to a very unhealthy weight. Started to have some physical medical problems. Um, my blood pressure was creeping up. I had sleep apnea. I had developed, well, I was right on the borderline of developing diabetes. And so in 2018, my husband and I decided we've got to do something different. Our two oldest kids were getting older. We were having a hard time keeping up with them. We both wanted another one and could not have another baby because of our weight. So we decided to go on a weight loss journey. Um, we both spent several years fad dieting, and we would lose weight and then gain it right back.
Sure.
So we decided to see a nutritionist at a bariatric center, and they gave us some just real life tips on how to decrease your consumption per meal without making any major changes to what foods you were eating and still lose a little bit of weight. The biggest thing was first increasing your water intake. So that was one thing we had started doing. And I found that if I would drink at least half a glass of water before I ate, I would be fuller and not really eat quite so much. She also gave us tips on, instead of using a dinner plate for our food, using a salad plate. So our portions were cut in half. And then we also, she gave us some tips, of course, on getting out. One of the biggest things was I had no energy to do anything when I got off work. I would come home and I would just melt into my couch. We had to really make an effort to, when we got off work, to get up and go outside and go walking. We would take the dogs down the road for a walk. Basically, the biggest thing was 30 minutes at least 5 times a day getting that heart rate up. And that really did help. It helped a lot. There were some other little tips and tricks that she taught us. And of course, then once we kind of started doing that, we started seeing some weight loss. She started talking to us about changing our diets. Instead of using butter to cook things with or margarine to cook things with, let's try olive oil or coconut oil, which are lower in saturated fat.
Mhm.
So we started doing that. I found an app on my phone where they gave you all these healthy, like meals that you love to eat, but changing them into healthier versions.
Right.
One thing that I absolutely love, I love to eat chicken salad for
Mhm.
lunch, chicken salad and crackers. So that's one of my favorite lunches. In fact, that's what I ate yesterday. So instead of making my chicken salad with mayonnaise, we started making chicken salad with cottage cheese and Greek yogurt,
Mhm.
which of course increases the protein content of it and also decreases the fat content.
Mhm.
And I started eating it with wheat crackers versus regular, club crackers.
Yeah. Full of oil and butter. Gotcha.
Right.
Mhm.
So just making those little changes did help. And then over time, we got to a standstill and we decided we need a little extra help. There are some really great surgical options out there, and we finally decided this is where we think we need to go with it.
Mhm.
Um, so we did after making those changes, because that's one thing that they'll do when you're looking into bariatric surgery is they want you to make these changes, because bariatric surgery is just a tool.
Right.
You can have the surgery, you will lose the weight probably, but you will gain it right back if
Mhm.
you don't eat the correct way moving forward.
Right.
So we looked into bariatric surgery. We did both have it, and that helped. But over time, just keeping our diets the same, not eating quite as much. And one other thing that I learned was we both ate very fast. I was a nurse, so I had, 30 minutes to eat my lunch and get back to my patients. Um, so over time, I just started eating extremely fast. He was one of six kids and mostly boys. So he had to get his food in
Yeah.
when he could. And then he worked on the road. So he kind of ate on the go all the time.
Mhm.
So both of us ate very fast. I learned that if you take a bite and then put your fork down and chew it and have a conversation, your stomach has time to catch up with your brain. Your stomach gets full a lot quicker than your brain realizes it. So when your stomach starts to get full and your brain doesn't realize it, you keep eating until you're just miserable.
Right.
And so as we were going through this, we started, we'd take a bite, we'd put our fork down, and we'd, talk a little bit as a family. And then we'd take another bite. And instead of us eating and being done in 10 minutes, it took us 20, 30 minutes because we were actually having conversation, which not only improved our weight and,
Mhm.
not feeling so dissatisfied and full when we finished eating, but it also improved our family life because we were actually having conversations with our kids while we were sitting at the dinner table eating.
Actually talking
Yes.
to each other.
Yeah.
What do you know?
Yeah.
Right? That's helpful, right? Yeah. But the idea of if you don't make changes, regardless of what takes place or what route you take, if you don't make changes in what you're eating and how you're eating, then nothing is going to work. So
Right.
it starts with you
Right.
deciding that, you know what, I gotta make some changes. And change is not easy, Ron.
No, it's not. It is a lifelong process. And do I still cheat? Of course.
Yeah.
But for the most part, I try to keep our diet as healthy as possible. My husband's family has diabetes, obesity has run rampant in that family. Hypertension and heart disease, it runs rampant in my family. So with our kids, I try to keep their diet as healthy as possible while still letting them have some treats here and there, but try to keep their diet as healthy as possible so they don't struggle with the same things that our family members and that we have struggled with.
Well, thank you for saying that and thank you for doing that because in my family, we struggle with the blood pressure, the diabetes, the heart issues, the obesity, and all of that, right? And I just made a decision that I needed a better life because I didn't want to go down that same road with people living sickly and dying too quickly. And so I became, pescatarian, then vegetarian, and now a vegan. And again, I'm not telling everybody to become vegan, and what Ryan is talking about, every step of the way can make a difference. So you just got to have some discipline and decide that this is the life that you want, a better life for yourself. Because normally, when you are obese, there's going to be some side effects to that, like high blood pressure, like diabetes, borderline diabetes, and full blown diabetes and high cholesterol because of the type of food that we're putting in our body. And you mentioned saturated fat, which is deadly to the arteries, right?
Yes, sir.
And so you got to be careful with these things. So the minor steps, and I like to tell people that, hey, this is my choice to be vegan because of what I've seen. And what you saw your parents do with your stepfather, you made some drastic decisions even in your career. And now you making some health decisions because you want to keep up with your children and you want them to have a better lifestyle. You don't want them to be where you were, right?
Right.
Yeah. So how are they adjusting? Because you do the shopping.
Yeah, I do the shopping. I do the shopping. And I did find that doing the shopping online helps too, because I'm not, especially if I went to the store hungry,
Right.
I would get all this stuff that just looked good. So doing the shopping online has helped a lot because I can actually plan out my meals and I can just get exactly what I need. I don't do this impulse buying. So my grocery bill is a little bit cheaper than if I were in the store.
That's
well.
a good tip, Ryan. I like that. That's another way you can control. When you know who you are, you can control the compulsive buying because you
Yes.
see things. And the stores, they don't just put stuff in the store, they strategize.
Absolutely.
They're going to have it, the worst food going to be right there at the counter when you're checking out. Yeah, you just grab it, put it in your bag, so for the chips and all these different
And
things.
Lord help us if you take a 4-year-old in there, she wants everything. So I've just started doing online shopping unless I just have to run in to get a thing of milk or something.
Yeah. So you and your husband have maintained that you started in 2018.
2018. February 14th, 2018.
So happy Valentine's.
I consider that our clean date.
That is awesome. And you look better, you feel better, you act better. Tell me, how has that helped you to be 190 pounds lighter affected your life?
Well, one of the biggest things, of course, the physical, the medical issues were weighing on me. But one of the biggest things was I was just very unhappy. I was, as I was going through school, I started learning about all the symptoms, like the true symptoms of depression and anxiety and irritability and mood instability. And I was like, I have this.
Yeah.
And so I started while I was in school. I learned part of what you learn in psychiatric nurse practitioner school is how different neurotransmitters affect mental health.
Mm-hmm.
So through that, I learned that about 95% of serotonin, which is the neurotransmitter that regulates mood, appetite, sleep, even can kind of inhibit pain a little.
Mm-hmm.
I learned that 95% of serotonin was produced in the digestive tract.
Wow.
So I started thinking, how does my weight and the food I'm putting in my body affect how I'm feeling? Well, if you think about it, it makes sense because if the serotonin is produced in the digestive tract, how does serotonin get from the gut to the brain? So the digestive tract is lined with millions of nerves, and it's, I guess, protected by good gut bacteria. And the food that you put in affects that bacteria. So bad food, high in saturated fat, high in carbohydrates, refined carbohydrates and sugars, it's going to produce more bad bacteria. Well, the good bacteria protects those nerves. It also helps to open up neural pathways that lead directly from the gut to the brain. So that kind of goes to how serotonin goes, it kind of gut brain health. So I started thinking, how can I support my mental health? Because at that point I was doing the therapy. I was on medications. I felt better, didn't feel great.
Right.
So I started doing some research. What foods can I utilize to help support me getting better and support my mental wellness? And I found that a lot of the foods that I had been eating, foods high in bad carbs, extremely sugary foods, high caffeine, what else? Saturated fats, of course.
Fatty.
They were really affecting me negatively because those foods can, with the carbohydrates, they cause blood sugar spikes, which initially give you a little bit of energy. However, your pancreas starts working and it secretes insulin and it drops your blood sugar, and you have that crash and you feel sluggish. You sometimes can experience irritability. You sometimes then feel depressed. You start to experience some inattentiveness with that. So I started realizing, if I stop eating these high refined carbohydrates and high sugar foods, I may not have those blood sugar spikes and crashes. So yes, I still eat carbs, but I do a lower carb diet, and I try to stick with good carbs. Carbs you get from beans and veggies versus the white bread and pasta and rice. But sometimes those things are needed in your diet. So as long as you do it in moderation, it's okay.
Yeah, and you just described the best carb for you, because when you start eating your beans and your greens and things like that, you're high in fiber, and it kind of removes the fat from the cells, so the insulin can do what it's supposed to do with the glucose because you're removing that fat. So and there are 4 food categories, guys, that I do want to mention this, and that is fruits. Make sure you're getting your fruits. The other one is your vegetables. Make sure you're getting your vegetables, your grains, and your legume, which are your beans and your peas. I don't care what else you're eating. If you can do these things, they're high in fiber, because the standard American diet, this is not Charles Orion, this is what studies have shown. The standard American diet, most people are receiving 5 to 10 grams of fiber per day. And what is needed is 30 to 40 grams per day. That's a big difference there. So when you talk about gut health, you can't have good gut health just putting bad stuff in there, right? And now you hear so many studies talking about gut health. It's like the second brain or something, right?
Yeah.
So you guys have been able to, and I want to just say this before I finish that statement. You're changing generation when you decide to make a change, because your children and now your grandchildren and your great grandchildren, because they've seen you all do it. But I want to say this, guys. It's not easy to change how you're eating. But if you want to change how you're feeling, you're going to have to make some choices. You can't keep doing the same thing, expecting things to change. You have to make some change. And that's mental. And that's hard, but it's hard being overweight, isn't it?
Yes. You got to choose your
You
heart.
got to choose your heart. And so let's be conscious of when we say, well, it's just too hard. Well, yeah, it's hard being healthy, but it's so much better. Right? You look great. I know you feel great,
Feel so
and
much
you're
better.
you feel so much better, and you're being out there in the community, being able to change other people's lives because you lived it, right? Yeah, that's the difference when you can live one way and then teach other people how you made changes. People tend to listen to you, don't they?
Yes, sir.
Great. Well, listen, this is so wonderful. Will you come back?
Sure.
So again, one more time, let's tell people how they can reach you, how they can touch where you're located.
So we're at Magnolia Psychiatry, 740 Avignon Drive in Ridgeland, Mississippi. You can reach us with our phone number at 601-937-4552 or on our website at magnoliapsychiatryms.com.
Thank you, Ryan. That's Ryan Doty. Has lost over 190 pounds, looking fabulous, feeling great, changing the world, making it happen. Reach out to them. They'll be happy to help you. You can always reach me at myhelpmymississippi.com. Let me know what we can do for you to help you to change your life for the rest of your life. We're so happy that we're able to bring you this kind of information on WMPR 90.1, where you can grab this information on the run. We like to say the number one station in the nation with the best helpful, healthy information. So our guest this morning has really shined a light on our health. So thank you so much again, Ryan, for being with you. And thank you all for being a part of My Help My Mississippi. We look forward to seeing you every Thursday morning between 7 and 8 a.m. And we'll do the same thing next week. Until then, have a great week. My theme, I love that theme. The future in great health today, every day, responsible self. When the fire